Well, I am in here today with Stacey. Stacey, welcome. I'm so happy you took time to come share you and your story with our listeners.
Thank you. Thank you for having me.
Yes, and we bumped into each other, which is what we do online, right? When there's, I'm still astounded at how many, and I say this with love, but well, in shock, but with a lot of love because I know our community, fortunately, unfortunately, is very big. Um, and maybe you're seeing this as well. I mean, I continue to bump in to more women, all ages, and I
Hmm.
mean men as well. But my space tends to attract more women. It's just it blows my mind how many of us are living with type 1 diabetes.
Yep.
Yeah, and I knock my head all the time. I'm like, wow, this can't be. So it's a good time to be here. I know we have so many tools and insulins. We're going to dive into all of that because you and I have a lot in common, not only age and hormones and perimenopause, menopause, but also, and I'm going to let you start with your story. You can just kind of share your diagnosis. You have been MDI. So you've been type 1 since you were, let's see,
6 years
since you were
old.
6 years old. So yeah, share, go ahead and share with our listeners.
Sure. I was diagnosed back in 1978, so I was 6 years old at the time. Therefore, I was MDI for 43 years. Up until 3 years ago when I found
Mm-hmm.
Omnipod, and I haven't looked back.
Mm.
Yeah, so that's where I'm at, or where I've been and where I'm going and where I'm heading.
Yes, yes. So, and you're in Australia. I'm
Yes.
assuming people maybe have caught on to I love the Australian accents. There's so much character, and it's just one of those things it always makes me smile when I'm hearing an Australian accent. Um, so what is life? What was your and I'm assuming you've always been in Australia. So this is where you were born, brought up. You continue
Yes.
to live there. So this is the culture. This is the environment that you're used to. How is it compared to? Because maybe I think there's confusion. I think it really does depend on where we live. United States has our expectations when it comes to how we manage our disease, how we're diagnosed, how we manage it, the tools available. But it's not that free and open across the world. So, what is it like in Australia?
When I was growing up myself from the age of 6, back in 1978, they didn't know much. There
No,
wasn't discussion about it.
they
I
sure didn't. No, I can
I
relate.
grew
Yeah.
up not talking about it. I didn't tell
Mm-hmm.
anyone. My friends didn't know at school. My friends didn't know when I was in my 20s. I only started opening up about it in my 30s,
Mm-hmm.
because I saw this amazing endocrinologist, and she changed my life pretty
Mm-hmm.
much. And that's how I started talking about it. The community on Instagram, that was really hard for me. Um, the fact that I've got my own um, Instagram about diabetes is mind blowing, because I would never ever do that. And I did that because I found another young lady, and she was talking about her diabetes. So I followed her for a little while and we were talking,
Mm-hmm.
and then I created my own, and that's how I've come up. But the community online compared to 1978, there was no online. There wasn't even
No, nothing.
friends that
Yeah.
that spoke about it.
Mm-hmm.
It's come a long, long way from what I
Mm-hmm.
remember to now.
Yeah,
So
totally.
very fortunate.
Yeah, I know it. Yeah, I was diagnosed in 82. So I was just a few years after you. I was 14. I get it. It was dark ages back then. And I understand the hiding, the shame. Nobody would
Yes.
understand. So I'll just keep it tucked away. I'll just handle it myself. That ended up causing issues later on. And well, throughout the years, it causes different issues. But I think the number
Yes.
one thing is just that living in that denial. Um, I think it's kind of a protective thing too. I think that's what I did. Even in my own family, there was, oh, she's got diabetes. She takes a shot a couple times a day. Um, eh. There
Yeah.
wasn't really any, but like you say, media wise, there was no media.
No.
There was no internet, there was no online presence. So it was a different time for sure. For sure. Yeah. So you've been MDI, so multiple daily injections.
Mhm.
You just switched over. So you're 3 years now on Omnipod.
Correct.
And at the time of this recording, I am 10 days on Omnipod 5. So
You
so
are.
we have a lot in common. I've been about 42 and a half years MDI.
There you go.
Yeah. Isn't that
Wow.
crazy? Yeah.
Yes, yes.
Yeah. So
It's
what made you say, okay, let's give this a try?
I was against. I didn't want to be on an insulin pump. I just didn't want a tube. I didn't want something hanging off of me. I didn't want
Yeah,
something stuck into me. I just did not want that. But as you know, lucky for us women, we go through, changes in life, as they call it. And
sure.
I knew I would hit perimenopause, and I knew that my it would affect my diabetes. I just knew, just with the conversations I had with my endocrinologist. So I just started Googling, and I found Omnipod and tubeless. What else do you want? It's tubeless. It works
Right.
all the time, delivers insulin. You can move it around your body. And
Hmm.
if I didn't do that, I don't think I would be able to manage my perimenopause that I'm currently experiencing
Okay.
on
Yeah.
MDI, because I used to see the fluctuations with
Hmm.
when I was ovulating, my blood sugars would spike, and I
Hmm.
knew I had to give myself more insulin. And there wasn't enough information for, I'm going to say, a young lady to read and understand how to monitor her type 1 diabetes together with perimenopause, menopause.
Hmm.
So, Omnipod literally changed my life with that, because I could see the ovulation when it was happening. I could see it with my dick as well. And it was just, it was, I couldn't get my head around it, that I could see the difference. I would spike in the morning once I'd have breakfast. So that's actually happening to me as we speak. As soon as I'm having breakfast, my insulin is spiking. So of course I have to pull up my new program that I've got for when I'm ovulating.
Yeah. And this, you're talking about something. I mean, you're definitely preaching to the choir as my dog stops barking. This is real life here. Hopefully he's not going to get flared up again. I can't predict. The mailman might be at the door. That's generally the reason. Yeah, when I started coaching almost 8 years ago, I was trained and I learned about hormones, but I was kind of separated at that time. I was early 50s, late 40s, early 50s. I hadn't experienced it yet. So I was like, well, okay. But I didn't put it together. I had no idea, just like you're explaining, what was about to happen.
Yeah.
I think I was one of the lucky ones because I had the training, I had the resources, but I still had to do my own digging. So what if, yeah, and it sounds like you do have a great doctor. So is your doctor, your endocrinologist right now, is he or she hormone educated? Do they understand how it's all kind of working together?
Yeah. My endocrinologist at the time, when pre-Omnipod, amazing. She warned me. She goes, if you're going through PMS now, you wait until you
Mm,
hit perimenopause. And I'm looking at it going, you're crazy. You don't know what you're talking about. I'm going to be fine. That's
you'll
what I
be
said to
fine.
her.
Mm-hmm.
Yeah. She's like, okay. She's since not my doctor anymore, because she's gone into another field, which is fine. So I'm seeing another endo, and he is amazing, and he does get it and he does understand it. It's just a little bit difficult talking to him about perimenopause, because he has said it straight out to me. He goes, I'm not trained for perimenopause, and I understand that some women would prefer to speak to another woman about it.
I
So
get
he's
that.
great. He's been fantastic. I mean,
Very good.
perimenopause for me started when I was 48. I'm 52 now,
Okay.
but I did not do anything about it until March this year.
Okay.
Because I saw a lot of symptoms. Before that, there was some symptoms, but not as much as of what I've seen now. So
Okay. So at that point, this past March is when it really started to rev up. Now you've already been on the Omnipod 5 pump. So,
yep.
and this is an interesting because like I said, I'm brand new on it. I'm still learning the settings. I'm still getting dialed in with it. Part of me saying, I think I want to go back to injections because I was, and one of the number one questions I'm getting asked, and maybe you got this asked too, is why now? And I said, well, because now I'm in menopause, I'm really dialed in really good. I think that's really important that we really fine tune the basic health habits that we all know we need to be doing, whether you have diabetes or not. Just get those dialed in, get consistent. And I've been able to do that. And that's when my basal was more predictable. This is again on injections. And I felt now that I'm feeling, not 100%, but I'm feeling pretty confident about my routine. Now it really is the time to kind of get curious, and I want to check this pump thing out. And it was another way for me to to connect more with my clients and women online, and just to be able to be part of that conversation. So you are already dialed in with your Omnipod 5 settings, and then all of this starts to rev up. So what was that an easier transition because you had already gotten, I keep calling them settings, but I'm still learning the language of a pump, but just the basal, the bolus, and the timing and all of that. Do you think that was
Yeah,
helpful?
it was super helpful because I had been overseas to Greece and I couldn't keep my blood sugars down. And I just thought it was because at the time I was taking a a certain medication, let's call it,
Okay, that's okay.
to help me to keep me regular and on time.
Okay.
And we believe that's what started spiking my blood sugars while I was overseas. Since I've come back, we've realized that even though that med that I was taking could have affected my blood sugars, for me, what I have found is the heat affects my blood sugars really badly. So I'm putting it down to that, because when I compare it to my blood sugars when I started eating perimenopause, they were erratic. And I've never seen such up and down. I mean, you do get your up and down, not a problem.
Sure.
Because I had been on Omnipod for, at the time, 2 years,
Mm-hmm.
seeing this again, I was like, hang on, no, we've got this. So
Right.
what's this? And I was researching going, oh my God, I must be going through perimenopause because my blood sugars are just erratic. And that's when I started researching even more, spoke to my GP at the time, not my endo. And that's how we discovered, yep, you're going through perimenopause and
Okay.
you need to consider what you're going to do with it.
Okay. So what have you done differently now that you realized, okay, this is what it is. This is what I'm dealing with. This is another variable that I've got to kind of account for. So
Yep.
how did you change? Is that something you were able to do on your own? It sounds like you've got a great relationship with your doctor. So that's a great communication yeah.
Yeah, I pretty much tell my doctors what we're going to do. They don't tell me. So,
Many of us do that. Yeah.
yeah, so I walked
Nobody
into
knows
my
it like we do. Yeah.
Yeah, correct. I walked into my GP and I said, I've been researching, I've been online, I've been listening to podcasts, going through perimenopause, you need to give me the drugs. And she's like, well, it doesn't work like that. I'm like, yeah, it does, and you are. And she's like, no, we're not. I said, okay. So, of course, she had to put me through the hoops and get all the medical tests that I needed to get done. You know, we're talking about a mammogram here, talking about a pap smear. She wanted to get all her ducks in a row and tick it off that I've done the appropriate measures. And I remember sitting in the consultation room, and I looked at her and I pretty much said to her, "Give me the frickin' drugs. Just give them to me. I am not coping." And I went on to HRT, and I have to say, it just all balanced out.
Yeah. I completely agree. I advocated the same way. I had to go in with the same sort of, and at first, they weren't even testing me at first. And that was something, what I went on, and just to, kind of on a high level, I know I've talked a little bit about what exactly HRT is here, hormone replacement therapy. It's estradiol, progesterone, bioidentical, yeah, assuming you are on the real stuff that our body is used to having, And it's interesting what you said, and I'm going to point this out because this is a lot of things that I'm getting from women friends that don't live with diabetes that haven't really considered HRT because they just don't know enough about it, so they avoid something that they're not familiar with. But you named it drugs, which I thought was interesting. You said, "Just give me the drugs." Now, it is because that's what women are telling me. Well, I don't want to go on any drugs, and
Yeah.
I'm not trying to point you out, but it's an interesting
No?
word. Is sometimes we just assume if it's anything we have to take that's anything out of a bottle, out of a can, out of a tube, or whatever, that it's a drug, that our body needs this. And in our case, it does need it. It needs it to get us back to what we were normally already struggling with. But it just, I like to call it replenishment, because we are naturally depleting. It's impacting our ability to function on so many levels, especially estradiol, how healing and supportive it is for so many of the receptors in our body. We see it so dramatically living with a disease that we have to monitor every minute of every day. So I think our segment of the population, and that's what I think frustrates me the most is that it hasn't been really recognized yet how important it is for women like us living with type 1 or any type of diabetes. It's not just type 1, but any sort of insulin dependent, metabolic, juggling act is really what it is. And then suddenly our insulin resistance just hits us and it just smacks us. And there's no consideration for that. What do you mean there's no consideration for that? We are human. We are proof it's happening. You can see and we're lucky to have the reports. We're lucky to have the data that supports this. We're not, and I just recorded with Azure Wolf, and that's going to, actually that one has already played here on the show. She is very much like you and I, and she's like, we're not going crazy. This is not just something that's going to pass, and diabetes is tough enough emotionally, just mentally, all those aspects. And menopause is very, very taxing on a woman's spirit. And then to tell us, well, guess what? You're going to have a chronic disease. You're going to be depleted. Just get over it. And there are no other solutions, which I think is just BS. I'll just be honest. So, yeah. So I'm just real happy that you were able to advocate and that you had doctors that were willing to take the time to give you what you needed. And you're already seeing a difference. So that's amazing.
Yeah, correct. Look, I called it drugs because I knew what it was. I know how it's identical to what we're losing.
Mm-hmm.
But she's a doctor. She's not going to take it any other way, right?
That's true. That's true. That's right. We're kind of speaking their language.
Yeah, give me my hormone. She didn't even want to prescribe this to me. She was trying to talk me out of it.
Yeah.
Because of what statistics had shown back in the days. And
2001,
I had done enough research and I was against it. When my original endo told me, oh, you're going to go on HRT, I looked and I said, no way, I'll never be doing that. And
Mm-hmm.
1 tier later, and I'm like,
Mm-hmm.
drugs, that's what I want, give me the drugs.
Right.
And it's when I saw my endo, he looked at me, goes, so how's it going? And I said, it's the best freaking drugs I've ever been on. And he goes, you look a lot calmer. I said, well, maybe they should prescribe them to men as well because you will need a dose. He just thought, okay, no problem.
Hmm.
So
Yeah. Yeah.
yeah, that's why I called it the drugs. I was calling it like
Yeah.
what you
Understood.
gonna help me?
Understood.
Yeah,
Yeah. 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 It's just, it's one of those stigmas, I think that, but, I had that same stigma that you did. I was like, no, I'll be fine. I'm doing all the right things. So far, so
yes,
good. Right. I probably won't need that. I don't know that I necessarily said no forever, but I discounted it. I didn't think it was going to be necessary until it was. It was definitely
right.
necessary. Yeah. So for you, just to kind of recap too, what were your biggest symptoms? When was it that the light bulb went? It's like, okay, no more of this. This is, I need help, and HRT is going to solve that.
Yeah. So erratic blood sugars.
Mm-hmm.
I was constantly sleeping at 3 p.m. out
Mm,
cold like a light. Just this exhaustion used to come over me that I couldn't control. And luckily, we work from home every so many days here. So I could do that. I'd go on the couch and I'd sleep, but I wouldn't sleep for 30 minutes. I'd sleep for hours. I was
wow.
exhausted. Um, I wasn't getting the flushes. I was sleeping, not a problem. What were my other symptoms? You've just thrown me now. I can't even remember my symptoms for me to go
Mm,
say, help me. My mental state, I did not feel myself. I came back from Greece, 7 weeks on the Greek islands, best holiday, and I was not myself. I was having panic attacks.
mm,
The anxiety that I've never had in my life was dialed right up. Um, I just wasn't myself, and I had no idea what I was going through. I just thought, okay, well, something's happening. And it wasn't until I spoke. So here in Australia, with work, we've got a system called EAP, and they're there for you if you need to speak to someone. If
mm,
something's going on in your life and you need to speak to someone, and I rang them because I wasn't myself. And this lady said to me, she says, have you had your hormones checked? Why would I need my hormones checked? I'm 51. I don't need my hormones checked. I am fine. I still get a cycle. I'm all good. And she started explaining to me how it all works. And I went, yeah, you don't know what you're talking about. That's what I said to her. I'm like, yeah, no
it's
problem.
funny. Yeah.
You don't know what you're talking about. Then I started listening to podcasts. Then women at work were saying the same thing. They were saying
Mm-hmm.
that they were on HRT and they were talking about their symptoms. And I'm like, yeah, but I don't get any hot flushes. I don't have any of that. And you don't need to because there's
That's
all
right.
these other symptoms.
Yeah.
So with my blood sugars, the exhaustion, the fogginess, whoa, that was out of control. Forgetting, not remembering in the middle of a
Mm-hmm.
conversation, and then just stopping and thinking, what was I talking about? Where was I going with that?
Mm-hmm. Mm-hmm.
So it was, for me, it's more mental than physical.
Mm. That's a great example because the symptoms are different for everyone,
Yeah.
and more dramatic. I definitely, yeah, I had weight gain, insulin resistance. My sleep was a little. My hot flashes were not too severe. I guess I was lucky that way. I was warm. I've always been kind of cold natured. I definitely felt a temperature difference, but it wasn't as dramatic for me.
Yeah.
And the mental focus, the brain fog, I think that was the worst. It really was. You think you're losing your mind. And I think what's interesting is because we also live with a disease, high and low blood sugar can mess with all those feelings. And I think that's one of the things that a lot of women that come to me, they're like, well, I'm not sure. Is it blood sugar? Is it my poor management? Is it really hormones? How it can be confusing. And I think maybe doctors are confused too when we come to them with these symptoms. Um, And then you tap on midlife, the pressures of all the different things. Life in itself can make us feel a little foggy. So there's
Yeah.
a lot of things to point at. And I think one of the things that's happening as well is women are often prescribed something for depression. They're
Yeah.
like, oh, well, just take this for your anxiety, take this for the antidepressant, an antidepressant for that symptom, without really digging down to really what the root cause is. Oh, you're living with a chronic disease. Of course you don't feel well.
Yeah.
So that's when I think it really gets confusing. And that's why it's so important to have this conversation to say, it could be a lot of the different things, but I think number one, it's important to start asking questions and to take your symptoms seriously and to not discount them. And it's probably not going to get any better on its own. I mean, it just won't,
Okay.
Yeah.
And I said to her, when I was in her clinic, I said to her, I said, I am not depressed. I am just not myself. Give me the
Mm,
effing drugs. I actually swore at her and said, give me the effing drugs. Just give them
mm,
to me. She was just
yeah.
putting me through loops. I said, give me the drugs. And that was the
Mm,
other thing. I started gaining weight and I'm like, nah, this isn't going to happen.
yeah. Yeah.
I,
Yeah.
I
It's,
refuse to let
yeah.
that happen.
Yeah. And, I think that's another advantage, again, we have with the disease, that we have to pay attention to how we're feeling all the time. So I think maybe, and not to compare women with diabetes or not with diabetes, but I think we're just naturally more in tune with what's not
Yes.
right, which again is an advantage. And it's another reason to challenge the doctors maybe that might be discounting or dismissing or gaslighting, all those terms that we're hearing. It's just so important to follow through. And you're really tapped into the community as well. And I think that's important. So if you're a woman listening today, and maybe this is the first time you've heard the show, or you've now getting to know Stacey, talking with us, reach out. There's conversation happening about this topic, and we're definitely here for you. And that's something that you have been able to you're part of the community. So you're adding to it. You're obviously part of it. You're contributing to the community. And obviously, you and I are examples of telling the story, just validating women just like us. Yeah. So what practices or routines do you rely on now to keep your body and mind strong? Is there anything
Um,
else that obviously HRT sounds like it's dialed in, right? You've got your
yeah.
your dosing and all of that. Mm-hmm.
Well, if that's what you want to call it, I started in
Ah,
March. Yeah, it was my 52nd birthday present by my doctor. Here's your gel and your tablets. You're taking your gel one pump a day,
okay.
and you're taking your tablets every 16 days for 12 days.
Oh,
Okay.
okay. That's interesting. Okay. Yep.
I'm like, all right, cool. So off I went. Not a problem. I felt the difference straight away. I was like, these are the best drugs anyone could give me. And then I heard someone say that they're rubbing the cream on their shoulder. And I'm like, huh? No, you rub your cream on the inside of your arm and you put it on. I'm like, okay. So I Googled and Google's telling me rub the cream in. I'm like, oh, okay. So Stacey's rubbing in the cream. And then all of a sudden, I've just hit rock bottom, let's say. And I found
Mm,
a new GP who specializes in women's health. Um,
mm,
and I said to us, something's going on. My mental state is really not where it should be. Help me. I don't know what I'm doing wrong. Please tell me this is all menopause related, because if it's not, I don't know how I'm going to cope. Anyway,
yeah.
so we went through the cream, the gel. It's not a cream, it's a gel, the tablets, blah, blah, blah. She goes, and how
Mm-hmm.
are you applying the gel? Oh, I'm putting it on my forearm and I'm rubbing it in. She goes, you're not meant to rub it in. What do you mean? She goes, you're not meant to rub it in. You wipe it on and you let it dry. So what do
Mm,
you mean? I said, I wipe it on, and then I rub it in. She's going,
right. What's the
yeah,
difference, right?
yeah.
Yeah.
It's not absorbing. Your body's not absorbing it because you're rubbing it in. So
Okay.
you're not getting what you need. And I'm like, oh my God. She goes, have you been doing this the whole time? I said, no, I changed in June. She goes, okay, you need to go back to that. And I said to her, and in June, I also upped my pump to twice because I felt that like nothing was working.
Okay.
Say it twice, but just put it on and wipe your hand, and that's it. Go and wash your
Okay.
hands.
Mm-hmm.
Oh God, what have I been doing? This is not right. Anyway,
Mm-hmm.
then she goes, if you still don't feel like it's working, up it to
Mm-hmm.
3 pumps. Well, okay, cool, not a problem. So I started the 2. I felt calm, started feeling calm, started feeling my mental health was just at a peaceful level. I mean, regardless of what I've triggered and what's happened and what I'm working on to get it fixed,
Mm-hmm.
I just felt back to what I was feeling when I first started in March. All right, I've been doing this wrong for how many months?
Yeah, I can relate to some of what you're saying. So just to back up too, so is your doctor, and you can share as much as you're comfortable with as far as are you still getting your levels checked, or are you basing this on symptoms? Because you're obviously basing it on symptoms as well. But is she checking levels? Is there an optimal level that they want you at?
She was amazing. She explained how it's all gonna work because I went in there and I went,
And you're still
please,
cycling too. So this is
correct.
different. Yeah, this is a different
Right,
dosing application, because we don't want to confuse women. I'm menopause, so I'm not cycling anymore. So
right.
my applications and what I dose is regular. It's steady. I don't. The reason you're doing it every 16 days, it's based on your follicular cycle, which is understood. And this is a good example of you've got to get with a practitioner that knows what they're doing, that knows
Yes,
how to dose according to your cycle, and that tests, that asks these questions. Yeah, yeah,
yeah.
perfect
No,
example.
my original GP hasn't specialized in women's health. So she was Googling a lot. She was listening to webinars. I just didn't feel comfortable because when I rang her and said I need to go up to 2, she said, you're not allowed to take 2. And I'm like, yes, I am. Like, I know more than you, I'm thinking. So she finally looked it up and she goes, yeah, that's not a problem. But in the meantime, I could feel I wasn't myself. Something was going on again. I had to
Yeah.
find another woman. And unfortunately, perimenopause and menopause has become such a hot topic in Australia that all women are seeking out doctors. So all the doctors weren't taking on new patients.
Ah, right.
I was stuck. And then this lady's popped up and I went, oh my God, it's a sign. I have to go and see her. And I went in there and the first thing I said to her is, make my cycle stop. When's this going to disappear? I want it to F off. I just want it to F off. And she actually explained how it's going to happen. My other
Mhm.
GP didn't say a word. She goes, we're going to do this and slowly we're going to stop it and we're going to change and we're going to do.
Okay.
I'm like, oh my God, where have you been all my life? In
Right.
regards to checking my hormones, because I've got my endo and I'm getting all that checked in
Hmm.
December,
Okay.
she just added more tests to that. So it's all going to
Hmm.
be done. She goes, I
Yep. I
want you
do
to
the same thing. Uh-huh.
Yeah,
Yep. Hmm.
because I want you to do it. I want you to go and have all these tests done together with your endocrinologist, and that way you're not doing it twice. So that's what she's going to go by. But yes,
Hmm.
it did go by how I'm feeling and what I'm
Yeah.
telling. She's just
Yeah.
amazing.
Yeah, yeah. And there's a lot of things that we've kind of talked about today, but yeah, I think the number one thing I say, especially for women in your stage, still cycling, to still get the levels checked. Most
Yeah,
doctors will say, well, I don't know what the levels mean, but a good practitioner is going to know the point of your cycle, what your levels should be, how to prescribe accordingly. And you mentioned application, which is another, that could be a hot mess as well. I went through the same thing because I was actually doing oral estradiol, which is now what I've learned because I challenged that with my own practitioner. I said, oral is not the way to be taking this. It's not absorbed properly through the liver. I had to convince her that I wanted to go on a cream, a compounded cream, which I did. And I was actually told to put it on the inside of my forearms. So
yeah,
basically right here. And then guess what? My levels dropped. And again, I was insisting on getting my levels checked because you can't just prescribe something and walk away. How do you know?
100%.
Yeah. So how do you know it's working?
Yep.
And your practitioner has to be able to establish what will be optimal for you. And that's a very unique number. So again, there's another reason for all these tests to be done. And usually it's about 3 months. Sometimes you can get it done sooner. But it's amazing how quickly, just like you experience, how quickly hormones are either going to help or they're not going to help at all. But
Right.
they can really impact a lot of these symptoms pretty quickly. I mean, within a week or two.
Yep.
So I and I was talking to a friend of mine. She's been on the show here, Kim Hines. We're both on HRT, started about the same time. And she's like, well, I do mine on the inside of my thighs because it really needs a little bit more fat. You know, there's definitely more fat on the inside of my thighs than on my forearm. And that's where the absorption comes in. Sure enough, I did my own change of where I was applying it. Within a couple weeks, those hot flashes that were popping up in that interim time went away.
Oh,
It's incredible. And my insulin resistance just slowed. Again, it's not overnight. Nothing is overnight, but you start to see the trends heading in a good direction. But it
yes.
just goes to show you we are so in tune. And then I got my levels checked, and sure enough, my estradiol was just it was in the toilet. It just plummeted based on where I was applying it.
Right.
And in this case, in the wrong place. So my body was not absorbing it. So yeah, it's so important to not only, so I continue to learn as well. And this is, these are definitely things to, to consider and to be able to walk into your doctor. Cause I think that's what I'm doing right now as a coach is that a lot of women are just, they don't even know where to start. So I have some guides and some directions to give them because you want to be able to have a conversation with the doctor. They may or may not really know where to start themselves. And if they don't, go see somebody else, get a referral. And that's something I can help with as well. Because there are hormone specialists around the country. A lot of them do telemed. You don't necessarily have to see a doctor in person to get this sort of care. You really don't. Testing, and a good practitioner is going to know how to do that. Get to know you,
Right.
do the testing, know what's optimal for you, and then and then to monitor them. But yeah, you can't just take and just walk away. It's definitely something that has to be monitored. I think about other hormones in the body. There's vitamin D. Vitamin D is very, very. It's commonly
Yep.
low. Here in the States, so many of us have to supplement for it. And that's a hormone that we want to have tested. We want to have those levels looked at. We want to know where we are. Thyroid's another one. I talk about this here on the show a lot about these hormones and insulin. Obviously, we're monitoring it. We're looking at the effect blood sugar has based on a hormone that we are injecting every day. So why wouldn't we be monitoring these reproductive hormones that later on in life come depleted? So it just makes sense to me. It's common sense. I tend to be very black and white with stuff. That's just the way I'm wired. I want
I
things to
do the
make
same.
sense, right? Yeah.
Correct.
Yeah.
I said to my original GP, I said to her, I'm not taking anything orally because she did the same with the estradiol. I said,
Mm-hmm.
absolutely not. I said, you Google that. It's not good for your liver.
That's right. You go to
So
the
I rang her.
experts. Yep. Science
Yeah. I
shows.
said to the
Good for
receptionist,
you.
get her to call me. And they're like, no, no, no. I said, I'm not taking the drugs. Get her to call me. And thank goodness, because she then not Googled it. She did a webinar or something and she realized what she should be putting me on. Great. But this new GP who specializes, she said to me, it's not just one for everyone. We have to figure it out and make sure we've got you on the right because you may need 3 doses. And she said, inside of your arm all the way up to your shoulder and then back on the outside. You just you just apply it. She goes, do
Right.
it on both. And then the third one, she goes, do that on your thigh. So I'm
Mm-hmm.
covering bases. But that's fine.
Right.
You
Yes.
just have to wait for it to dry. Like you're literally sitting there waiting. And tonight, because I was out at the Coldplay concert, I've come home
Mm-hmm.
exhausted and I'm literally on top of my bed just waiting for everything to dry so I can get under the sheets and warm up and go to bed. So, you know,
Yes, yes. It's a small price to pay, but yeah,
correct.
right. But we're thankful that we have the choice to do it. And overall, we're feeling a whole lot better, aren't we?
Oh,
Yeah,
absolutely. It
yeah.
was Louise Newton. I don't know if you've heard of her. She's from the UK.
No. Okay.
Dr. Louise Newton. I'm sure it was Newton.
Okay.
Oh,
Yeah, that's good to know. Yes. Oh, yeah.
she's
There's so
amazing.
yeah. Yes,
Yeah.
we do. We have some amazing hormone specialists, OBGYNs that do actually specialize in hormones and menopause. So there are some great resources out there and great doctors to refer to. So what would you, looking back on what would you tell your younger self with type 1 growing up and now that you are in a different stage of womanhood? I love that word,
I would have
womanhood.
said, I said it to my niece a couple of weeks ago. I would have started this journey on women's health as soon as I saw the symptoms. I did start, to be honest, I did start. Unfortunately, the endocrinologist I saw once and once only fobbed me off. I wish I had started my HRT, hormone replacement therapy, as soon as the symptoms began,
Mm,
rather than waiting to get to the point where I'm at, because
yeah,
that mental fogginess,
yeah,
oh goodness me,
yeah.
the not feeling yourself, I don't wish it upon anyone,
Mhm,
and I'm struggling with it, and I want to find my sparkle, as I call it,
mhm. I
and
like
be
that.
yeah, and just be happy again because I'm really not. And I want the irritability and the frustration to just go because that's not who I am. And I know it is part of being a woman and these are the symptoms. But if we've got HRT that can help us, then why not? Why wouldn't I?
Yeah.
So I wish I had started earlier.
Yeah. Okay. And that's an important thing too. And looking back, because I haven't thought about it until I asked you, I probably would have insisted earlier as well because I kind of just tolerated those things that weren't as weren't as sharp as they used to be. And I totally agree. I think the insulin resistance could have been kind of curtailed a lot earlier for me as well if I had
Yeah,
just kind of stepped out. Yeah, because I did wait till I was menopause. So menopause is basically a full year without a cycle.
correct.
Um, and you are a really good example. And I've had a lot of other conversations about women that are just in that stage where you are. Don't wait. It's not too early. So it
Yeah,
really is. It really is about finding a good doctor that's going to have this conversation with you and to help support you. So, yeah. And that sounds like that would be your advice for women in our space right now.
absolutely.
Yeah.
Absolutely. Because I was waiting for menopause because I understood what perimenopause was, pre-menopause, but I didn't understand when perimenopause starts and what happens.
Hmm. Hmm.
And even though I knew menopause is when your cycle stops, I was waiting for my cycle to stop and then start the HRT. I didn't realize you
Right.
could start HRT earlier
Right.
to prevent everything because you're getting symptoms. And because I wasn't getting your typical hot flushes that other women always talk about, I was not really into it. And, we go back to years ago and they're saying that the data back then showed that HRT isn't good for you. And, we grew up like that,
Hmm.
knowing that how are we gonna take it? And then I just bit the bullet and went, "It is what it is.
Yeah.
I'm taking a risk. I'm taking a risk." And even
Yeah.
my GP at the time, not the women GP that I'm seeing, she even said, she goes, "Oh, there's an increased chance of breast cancer." And I went, "There's an increased chance of me getting hit by a bus." She looked at me like, "You can't say that. That's
Yeah.
old school.
Good
It's
for
proven.
you. Yeah.
It's actually proven. They've got data, they've got statistics that you can get hit by a bus just as much as you can get breast cancer. So just give me the fuck oops, sorry. Just give me the
Okay.
drugs. So, give me the fucking
I love
drugs.
your passion. I know.
You're
It's
gonna bleep me out.
it's okay. I got an editor. It's about feeling good here now. It really is. I totally agree. And another thing that was asked by my doctor when I was on it for a few years, well, do you want to keep taking this? And she actually put the doubt in my mind at the time. And then I went back, thought about it, prayed about it. I was like, why would I reverse what feels good when the
Yeah,
data supports that this is going to support us as women to stay vital, functioning, how important estradiol and all the hormones that work together are going to do for our quality of life from here
correct.
until I leave this earth. So the answer is yes, I will continue taking it.
Yeah,
So
correct.
yeah.
I'm a big believer. My journey is my journey. And if
Mm,
my journey involves that I get breast cancer, then that's my journey. I can't do anything to alter my journey, whether I
yeah,
take HRT or I don't. If my
right,
journey
right.
breast cancer, whether I'm taking HRT or not, it's going to happen,
I totally
right?
agree. I totally
I can't
agree. Yeah. Those are
to
things that
believe
we can control. Yeah, I totally
it.
agree. Yeah.
You knock on wood that it doesn't, but I can't live
Hmm.
my life like that. I've been living my life with diabetes since the age of 6 for how many years? And I'm
Hmm.
at the point now where it's my life was dictated by a vial of insulin that came from animals at the time. I'm sure it was
Hmm.
pork insulin.
Yes,
You
I
know, and
remember
yes,
that too.
it's developed to it's human now, but I relied on that to live. So why am I not going to rely on estradiol and the the progesterone, however you pronounce that one,
Progesterone. Hmm.
progesterone? That's it. Why aren't I going to rely on that to get me through this time of my life
Hmm.
that is driving me bananas? I would, that would lock me up because I reckon I would have murdered someone. I was
Right.
that
I get
irritable and
it.
frustrated, and yeah,
Yeah.
you couldn't even speak to me without me reacting. You could
Mm,
just breathe and I would have lost the plot. That's
right.
how far down I got to.
Yeah. Understood. Thank you so much, Stacey. I
I,
appreciate you. Yes, I
no,
appreciate your passion and coming and being so honest about your story and sharing the real you and just to see that, there, once we get to that decision, gather the facts, dispel the myths, which I continue to want to share and support here on the show. So how can our listeners find you?
sure. I'm on Instagram. They can find me there, and my handle is me and type 1 diabetes.
Mm-hmm, mm-hmm. Yeah, I'll
It's
link it
pretty
here in the show.
self-explanatory.
That's
Yeah,
okay. I'm going to link it to make it easy. They can connect
thank
with
you.
you. And again,
Absolutely.
yeah, I appreciate you, and I appreciate you being in my circle as well. You're an added bonus. I love your spirit and your passion to be here, and keep being you, Stacey. We appreciate you.
Oh, thank you. Thank you. I'm not overly spirited. As I said, it's 3:30 in the morning here, and
That's okay. Yes, I
I was at
appreciate you taking it.
Coldplay, rocking it with Coldplay, which was
I
great.
know.
I've only
I
had a couple
know.
of hours sleep, but more than happy to help. And if this podcast helps just one woman, then I'm
Hmm.
happy. And I'm not regularly on, and I do go on every so often. So if I don't respond, or if you write to me and I read it and I haven't responded, it's the brain fog. You read it and just go, did I see something? Did I read something? So they can find me there. Just be patient. I'll get to you, and I'll help
Absolutely.
where I can. And I'm not a medical professional, but I am talking about my experience. And
Yes.
I,
That's the most important thing. Yes. Yes. We're here to support and to validate what we're going through. So,
yeah,
all right. Well, thanks again, Stacey.
that's all
And
right. Thank you.
yes, and be sure to share this show. Yeah, this was a real conversation, real story
Excellent.
and experiences, and share it with some other ladies. So we'll be back
I
in here
will.
next week. Yes.
Perfect.
All right. Be well. Bye.
Thank you. See ya. Bye.